Hello, hello. Welcome once again to Dr. Paula's Breast Health. Yet another day, yet another session, more education, more power. Knowledge is power. Today we are going to be talking about the different types of breast cancer. We spoke about cancer and what it really is. We said it's an uncontrollably multiplication of the cells in whatever part of your body, wherever the cancer occurs. We said that it can happen anywhere in the body, it can happen in any organ, it can happen in the blood even. And then once we spoke about what cancer generally is, we said breast cancer is the uncontrollably multiplication of cells in the breast, whether it's in the duct or whether it's in one of the glands. And but there are actually different kinds of cancer. When you hear about breast cancer, it's not just a lump in your breast that you're going to feel while you're taking a shower. Sometimes it's just a symptom, an appearance, and we today are going to be talking about one of the deadliest breast cancers, which is called IBC, or Inflammatory Breast Cancer. This cancer is actually very rare. It only happens in about 1 to 5% of all the breast cancers happening. And although it most of the time originates in the duct, which is a form of ductal cancer, breast cancer, but the symptoms are very different. And so for the woman who is really not vigilant and who is not looking out for symptoms, you may just overlook it. You may just think, oh, I'm having an irritation of the breast, it's no big deal, particularly for a woman who is breastfeeding. Sometimes when a woman is breastfeeding, they may come down with what we call mastitis, which is an inflammation, and sometimes it's an infection in the breast. And the woman may just overlook that symptom. But inflammatory breast cancer can happen even if you are not breastfeeding, of course. And some of the symptoms, it's very different from your regular breast cancer. And some of the symptoms are, one, it may not always show up on a mammogram. Sometimes it doesn't show up. It's happening most of the time in women who are younger than 40 years old. So you're finding that, the young ones are the ones coming down with inflammatory breast cancer. And we said that at that age, typically, a woman is not having an annual mammogram or biannual, or whoever the doctor, whichever regimen the doctor uses. So it's happening in women who are younger than 40, and it's happening more commonly in African Americans. So the incidence of inflammatory breast cancer, according to the literature, is higher in African Americans. It happens more in women who are overweight. Like a lot of cancers, actually, I guess they love the fat cells. So inflammatory cancer is happening in overweight women most of the time. And it is a very, very aggressive form of breast cancer. And when we say aggressive, we talk about, how rapidly the cells are multiplying and how quickly it is moving from one part to another. For inflammatory breast cancer, most of the time, it is so aggressive that, as a matter of fact, once it is discovered, because it's already in the skin, it moves from whatever side. What happens in inflammatory breast cancer is that the cells, when we talked about cancer, we talked about all the different, parts of the breast, and we talk about in the breast, you also have lymphatic channels, those little lymphatic vessels that's carrying the lymph node, that carrying the lymph fluid from one part of the body to another. So what happens in inflammatory breast cancer is that the cells get into some of these little lymphatic channels. And the lymphatic vessels are very, very close to the skin. And once the cells get into the lymphatic channels, it blocks them. And that is what is causing the inflammatory reaction. It's the breast is getting warm, it's red, it's like mastitis, like when a woman is lactating. So most of the time, that inflammatory breast cancer has moved. So it starts at stage 3. Because it has moved to the skin, which is an organ, starts at stage 3. Now, inflammatory breast cancer has really the worst prognosis. And when we say the worst prognosis, we are saying that, you know, how likely is a woman who is diagnosed with breast cancer to survive it beyond 5 years? So it is one of the cancers that is very, very deadly and has a very, very bad prognosis compared to, you know, your regular DCIS or your regular ductal carcinoma or your regular, you know, glandular carcinoma. And so what are some of the signs and symptoms? And these are the things you have to be really, really vigilant about. We said that every woman should know her breasts. So when you look in the mirror every day, you need to know exactly what your breasts look like. Is the left one normally is a little bigger than the right one? You have to know whether there are any abnormalities in the appearance of your breast when you look at the mirror. And definitely you need to know what your breast feels like. Like we said, many women have what we call fibrocystic disease of the breast, where they're having a lot of lumps. And sometimes it's difficult to pick up an abnormal lump because you are so used to all this lumpy, lumpy, lumpy breast feeling. And so the signs and symptoms are: 1, the breast is going to be tender because it's swollen, it's warm, and it's red, and therefore it's uncomfortable. It's tender. Red and sometimes a purplish appearance. And sometimes it may be itchy, an itchy feeling. And the other appearance that is very unique with inflammatory breast cancer is that it has that pitted appearance. You know, when you look at an orange, you see the little holes in the orange. And when you touch an orange, how the outside feels very thick. Well, that's what breast cancer appears like, and that's what it feels like. It has that pitting appearance, and it feels thickened when you touch it. And so that's why they call inflammatory cancer, and that symptom, they call it peau d'orange, which is a French term. It is peau d'orange, means orange peel. So it has that orange peel appearance. And then sometimes in inflammatory breast cancer, if you look at the nipples, it may be inverted or it may be retracted. All right? So these are the symptoms of inflammatory breast cancer. Please, women, be alert. Be alert for symptoms of inflammation, particularly if you're not breastfeeding. Warmth, thickening of the skin. 1/3 of the breast might be red, or it may have a purple appearance. Itching, discomfort or pain, that pitted appearance, which looks like an orange peel. And then look at your nipples to see if anything has changed. Is it retracted? And so if any of these symptoms happen, you need to consult your doctor. In the woman who is lactating and who's breastfeeding, the doctor will, look at the breast, of course, do a physical exam, and they may, if they think the woman is having an infection, treat the woman with antibiotics, probably for a week, 7 to 10 days. But if after a week the symptoms still persist, then the doctor may get a little suspicious that it may be inflammatory breast cancer. And yes, a lot of women actually come down with cancer while they're pregnant or while they're breastfeeding. And so you have to look out, you have to be vigilant for these symptoms. You know how we take things for granted? We go about our everyday lives. Or we may just have a symptoms and we say, it's this and it's that. And we go about our busy daily lives, and we said, I'll schedule an appointment with my doctor, and maybe next week, and next week comes, and then you procrastinate and you keep putting it off. And you have to understand that when you procrastinate in cancer, when you have cancer and you keep putting it off and you keep not telling anyone about it, you are actually allowing that tumor to metastasize. Remember what we said about metastasis? The cancer moves from the primary site to the secondary location. So in the case of breast cancer, we said that the places it normally moves to, your brain, your spine, your liver, your lung, these are big organs. So when these organs get affected by cancer, all it does is complicate treatment. It makes it so much more difficult for your physician to treat you and for you to get over this crazy journey. I call it a crazy journey because it is nothing that any woman wants to go through. You do not want to go through breast cancer treatment because I've been through it, as I told you in my previous videos. It's horrible. You're weak. You look ashy. And of course, you know that every hair on your body drops off. So you really do not want to go through it. So what will the doctor do if he suspects you have inflammatory breast cancer? Well, he will do a mammogram, and yes, sometimes it will be detected, sometimes it may not be detected, and he will do an ultrasound, of course, or he may do an MRI. And even for women who have had breast cancer, or sometimes if the doctor is suspicious that you are having some issues with your breast, you may have really dense breasts, sometimes they will do mammogram. And of course, you know about the 3D mammogram. Now, a lot of facilities now have the 3D mammogram, and it has become part of their routine. So what the 3D mammogram is very digital, and so it takes a lot of pictures, puts these pictures together, and gives you a much clearer image of what's going on in your breast versus the regular mammogram. So most of the time, they will offer you a 3D mammogram, or some hospitals, it has become routine. That's all they use, 3D mammogram. And the MRI, of course, you know, is much more sensitive. And when we say sensitive, we mean that this test is able to pick up any abnormality much easier than the regular mammogram. And so sometimes, one of the disadvantages of MRI, or we'll talk more about the different tests and the benefits and the pros and cons. MRI, because it is so sensitive, meaning it is so able to detect any little unusual stuff happening, will sometimes pick up things that are not actually breast cancer. So you find that you may be subjected to biopsies much more than if you had regular mammogram. But it's all good because the MRI will pick up the breast cancer if it's there. And so they will do an MRI, as you said, ultrasound maybe, or your regular mammogram. And then, of course, the doctor will order a biopsy because this is how he's going to look at the cell to see whether the cell is different. If it has the cancerous characteristics, it will definitely tell you whether it is cancer cells. So the biopsy really is going to be one of the most accurate methods of testing for the cancer. So what about the stages of breast cancer? You know, we talk about stage 0, stage 1, stage 2, 3, 4. When inflammatory breast cancer happens, it is off the bat stage 3. Because it has moved to the skin already. And if it moves to a distant part of your body, then now we say that it is stage 4. Stage 4 inflammatory breast cancer. And as we said, it is very difficult, much more difficult to treat a stage 4 cancer, any cancer actually, than if it's just stage 1 or inside 2. So if you were diagnosed with cancer, the treatment will be 1, chemotherapy, And then once the chemotherapy is complete, once the chemotherapy has shrunk the tumor, which is the objective, they want to shrink the tumor before they can go in and excise it. Then the doctor will go ahead and do surgery and radiation, of course. So, and sometimes even after chemotherapy and sometimes after radiation, they may treat the woman more, because breast cancer, the inflammatory breast cancer it's difficult to treat. It's more aggressive, and because it most of the time has spread to other organs, treatment is more challenging than regular breast cancer. And so, ladies, please be vigilant. You need to look at your breast, and if you find that part of your breast looks weird, it's red, you know you're not lactating, you're not breastfeeding any baby, you want to definitely, immediately consult your physician so they can do the necessary tests to determine whether you are having inflammatory breast cancer. So next session, we will be talking about, other types of breast cancer. We have to talk about the triple negative. It is so important, and you need to know about the triple negative breast cancer. So we'll talk about the triple negative. We'll talk about, the regular breast cancers, the ductal, and the treatment, the DCIS, and the treatment for them. So thank you guys for listening, for watching. If you have not subscribed to this channel, I would love for you to hit that red button. You see subscribe in red? Hit that red button, and also hit the bell. There is a little bell symbol. I want you to hit that bell symbol, and I need you to share this video with your friends and your family and your colleagues, your fellow students. Please do not keep this information to yourself, because it is so important. Thank you so much. See you next time. Dr. Paula's Breast Health is on the way to teach you, educate you, and empower you with knowledge. Have a good day. Take care.